The technique and recommendations suggested during this training video are intended for healthcare professionals only. If you are not a healthcare professional, please seek the advice of your personal physician. Please note that all of the products used during this demonstration can be ordered via hksurgical.com, or you can call HK Surgical directly at 800-909-0060. This is an informational overview introducing some products and general procedures to use when dressing a post-operative liposuction patient. The smallest being an extra small pad, dimensions 5 by 12, and the largest being an extra large pad, dimensions 31 by 12. HK Surgical garments are available in the following styles and colors. Our Optimum garments are available in either tan or black. The HK Optimum arm and back garment. The HK Optimum overall garment. The HK Optimum torso garment. The HK Optimum breast torso garment. The HK Optimum tank torso garment. The HK facial garment. Our Maximum garments are available in either black or white. The Maximum short zipper overall. The Maximum zipper overall. The Maximum male compression vest. The following instructions apply for all surgical areas. Before the end of the liposuction procedure, you should cut plenty of tape and select the appropriate size and style of HK Surgical compression garment, HK super absorbent pads, and latex-free netting. A size chart is available to assist in garment selection. The use of open drainage with bimodal compression is recommended to minimize edema. Open drainage refers to expedited drainage of blood-tinged anesthetic solution via incisions not closed by sutures. Bimodal compression refers to 2 sequentially applied degrees of postoperative compression. The first degree is a relatively high-grade compression that accelerates the drainage via open incisions. The second is a low-grade compression employed after drainage has ceased. It is mild enough not to collapse the lymphatic capillaries, but adequate to increase interstitial hydrostatic pressure. When applying the HK pads over the surgical area, all of the incisions must be covered, taking care not to place the plastic borders of the pad over any incisions. If needed, you can overlap multiple pads so that the entire area is covered, but you do not want to cut your HK pad. Cutting the pad will result in a non-sealed side. The edges of the pads must be taped securely to the skin without any gaps to prevent fluid from leaking out from under the edge of the pad. Paper tape is recommended as it is more hypoallergenic and because the adhesive on other types of tape can be quite difficult to remove when changing the pads. After HK super absorbent pads have been applied, the latex-free netting is used. Paper tape is not super sticky when first applied and may loosen even before the garments have been put on. The netting helps to keep the pads in place while the HK compression garments are applied. When cutting the netting, it should be cut a little long, as when stretched open, it becomes shorter. Once the HK pads and latex-free netting have been applied, the 2 HK compression garments are placed on the patient. Some areas require layering of 2 garments to provide bimodal compression. The drainage can leak through at the edges of the pads, especially if the tape lifts. If this occurs, the patient should reinforce or add an extra small HK pad to the wet area. The pads should not be removed or changed on the day of surgery, but are changed twice a day starting the day after surgery until the drainage stops, which usually takes about 3 to 6 days. The tape is uncomfortable and difficult to remove. After the first 24 to 36 hours, the patient no longer needs tape on all the edges of the pads that keep the drainage from seeping out. The netting alone can be used to hold the pads in place. The patient can either hold the pad onto the surgical area while a second person slides the netting on, or the patient can put the netting on and then stretch it out and insert the pads under the netting. Using the netting results in less tape applied to the patient, thus minimizing the skin reactions and tape discomfort. It is suggested that you supply the patient with the following items to take home after surgery: 2 compression garments or 1 compression garment and binder, HK pads for 2 complete dressing changes, plus several extra small HK pads for the few incisions that may continue to drain for up to 3 to 6 days. 1 or 2 pre-cut sections of latex-free netting. The netting can be used more than once. And 1 roll of paper tape. Thank you for viewing our post-op training video. We hope you find this information beneficial to your practice. The technique and recommendations suggested during this training video are intended for healthcare professionals only. If you are not a healthcare professional, please seek the advice of your personal physician. Please note that all of the products used during this demonstration can be ordered via hksurgical.com, or you can call HK Surgical directly at 800-909-0060.